Good afternoon. I'm Michelle Horn. I'm also from University of Mississippi Medical Center. So we're going to spend the next half hour or so talking about formative and summative assessment. So I also don't have any disclosures. As far as objectives for this, kind of incorporate some methods by which to assess each learner, but also to recognize the skills needed to do some formative and summative assessments and develop an understanding of the whole evaluation process. So, we all undergo assessment, give and receive assessments every day, right? Whether you're on social media or just life in general. So if you're on social media, you get likes on your Facebook account or your Instagram account or your tweets, or even on your coffee. I like your smiles, enjoy your flight. So we're all getting some sort of reinforcement or positive feedback in some form or fashion throughout the day. Hugs from our kids or our spouses, smiles from our coworkers. You can also get negative. So you can be disliked or unfriended. So we're always receiving these positive and negative feedback throughout life in general, not just in the workplace, but also in our daily lives. And that can lead, that formative feedback that we get every day can lead to summative. So this is the obligatory kid slide, but as you can see, they've gotten formative assessments or formative feedback throughout to get to where they are with these, whether it's getting a ring or a certificate or a great grade on handwriting or going to the spelling bee. So there's always things that they've worked towards and gotten feedback along the way to get to that point. So first we're going to talk about, if you're going to give formative and summative assessment, how do you assess? And some of you may have heard this before. We've kind of mentioned it. I think Calvin had it in one of his slides earlier, but the 1-minute preceptor is something easy you can do whether you're in clinic or in the hospital. So you want to get a commitment, probe for supporting evidence, teach the general rules, and provide positive feedback and correct errors. So the commitment. This is what I think of as the what question. So once your learner has presented the case, you ask them, what do you think is going on? And make them commit. If they say, well, I'm not sure, I got to come up with something. So what do you think is going on? You don't want to offer your own opinion. You want them to take the opportunity to kind of assimilate all the information in their mind and give you an answer. And then the next step would be, well, why do you think that? And that's what Dr. Henson had mentioned earlier. You got to get sometimes at the why as well, because they can go through this all the time knowing kind of the what as they get more experience. But why do you feel like that's going on in this particular patient? Why did you make that decision? What led you to that diagnosis? And then once you've gotten to that point, then teaching them the general rules about that particular topic. So if it's somebody that presented with chest pain and they feel like they've got unstable angina, then talking about that and talking through that and teaching them a general rule about those key features so that they can take all that and generalize it to other cases as well. And then give feedback on that. And we'll go into a little more depth about feedback in a little bit, but just giving some positive feedback. So reward and reinforce what was done well and why. And be specific. And if you don't take anything else from this talk today, remember that key phrase. Be specific in whatever feedback you give, because that's what learners want. You don't want to be general. And then correct their errors. Sometimes it's pretty helpful when you sit down with someone to give them feedback is to have them self-critique first. So asking them, how do you think you're doing? What do you think you're doing well? What do you think you need to work on? Because sometimes they can give you really good insight on things you may not have even thought about that they need to work on. And again, be specific and make recommendations for improvement. So get a commitment. This is the what. Probe for supporting evidence, the why. Teach them general rules. Provide positive feedback and correct errors. So formative assessment, sometimes I like to think of this as the good, the bad, and the ugly, because it's all about giving good or positive feedback, but also correcting errors, and especially in those learners that may be a little bit behind where they need to be. Sometimes that can be a little more difficult discussions to have with them. So some things as far as defining feedback, there's lots of things out there. If you Google feedback, you can get lots of images and videos and things like that. But one of the definitions is comments in the form of opinions about and reactions to something, and it's intended to provide useful information for future decisions and development. I really like this definition of formative assessment. It's a range of formal and informal assessment procedures used to modify teaching and learning activities in order to improve a learner's attainment. And then the summative, it seeks to monitor outcomes and offers often for the purposes of accountability. This is another really good way to think about feedback and evaluation. So remember that feedback or I use the term feedback, but also formative assessment, is meant to be immediate. Of course, it's formative and it gives information. Whereas evaluation or summative assessment is more delayed, and it's a summation of things, and it provides more judgment. So this is a scenario we'll come back to in a little bit and go into a little more depth about, but you're on rounds, or if you're the resident on rounds with a student, or this could be the resident and you as the attending, and the student's presenting a case. Miss Johnson is our 65-year-old with right arm cellulitis. She's on day 3 of bank. She has no complaints, and the exam is clear. So the resident interrupts and says, you can just give us the pertinent findings, including her vitals. And the student proceeds. Her cultures came back as MSSA. Since she's improving, I thought we could continue her on the VANC for a 14-day course. And the resident says, typically we only use VANC when the culture comes back as MRSA because of resistance. We'd like to limit the use of VANC. And the rounds proceed, and the resident tells the student, good job, before moving on to the next patient. So, was this feedback? Yeah, maybe, sorta, kinda. I mean, you did some good things, you did some not so good things, and we'll kind of go into things a little bit more later. And was it effective feedback? Probably not. So what are some barriers to effective feedback? And we all have this at different times, depending on the learner and where they are in their training. So if you have that outstanding PGY3 resident that's about to be the chief resident, sometimes it's very difficult to give formative feedback to them. Or if it's the struggling resident, I think number one is very difficult because you worry sometimes about upsetting the learner. We all want to be liked and we want to say really good things about people, and sometimes we worry about making them upset. So then you may not provide feedback at all, or you do it very infrequently. But remember that everyone wants feedback. We want feedback on how we do as attendings, or if we're residents, we want that feedback. Students want that feedback as well. So they want it. So giving that is in the appropriate setting and in the appropriate manner is what needs to be done. So another barrier that we sometimes hear is that they just don't remember the feedback. I gave them feedback. They didn't do what I told them to do, or didn't do what I suggested how they change, and so they just didn't listen to it. So they fail to act on the feedback. Well, then the learner can come back and say, well, I didn't know I was getting feedback. So it's important to label feedback as that. So when you're giving feedback, you want to label it as feedback. We joke a lot about this, that there was an attending previously that would use feedback hands. So on rounds, he would say, I'm giving you feedback now, and he would flash his hands. So whatever it takes, specifically labeling what you're telling them as feedback. And then another barrier is that feedback does not contain the needed components. So there may be specific things that you feel like they need to work on, but you're kind of giving more general things. Like, I feel like you need to work on your presentations. Well, what does that mean? I mean, that could be very broad. So making sure, and that can cause the learner to not necessarily improve because they don't know what you're thinking necessarily. So you have to be very specific about things and consider planning the feedback session with them and telling them it's feedback and giving them notes. And then again, the too general, which I just mentioned. So it can, the learners just don't improve and get frustrated. So you want to be specific in the feedback. And there's that phrase again, be specific. So a mnemonic that's sometimes used, I know Dr. Henson mentioned mnemonics, insight. So inquiry is listening to the learner's concerns, and needs is listening to the learner's needs. So this is where you kind of sit down at the beginning and ask the learner, what are some things that you want to work on throughout the next however long we're here, or today while you're in clinic with me? What are some specific things you want to work on while you're here or learn about? And then giving specific feedback, starting with the positives, which we'll talk about a little bit later. Balancing the learner team needs. So, the resident may come and say, I really want to work on this as part of this, but does that meet what the team also needs as well? And then setting goals, the help and the timing, and making sure the follow-up is timely. So this is another thing as far as feedback is concerned. When you give feedback and the learner makes those changes, you want to follow up with them and say, hey, we sat down, we talked about this, you've really done well with what we discussed, but I still feel like you need to work on this. So it's an ongoing process. Just because you give feedback once doesn't mean you can't do it again. So it may need to be an ongoing thing. So there are different types of feedback and different ways in which you can do feedback. It can be more formal or scheduled sessions. Again, this is where you kind of sit down at the beginning of the rotation or at the midpoint. At the beginning, set those goals, and at the midpoint say, this is what you're doing, this is what you're doing well, and this is what you need to work on. And then for longer, more complex decisions, you want to kind of have that post-event setting to give, especially more sensitive things with that really struggling learner. So we'll talk about in a little bit as well that sometimes it's like the resident did in that scenario, given the feedback about just give me the pertinence and the vital signs. That was appropriate to do at that time because that can also be applicable to others that are presenting to that resident. That's how he or she wants that information presented, so that the next learner that presents can know that that's what is expected and what they need to do. But if it's something personal and just related to that particular person, then sitting down in a private manner and having those discussions. So it can also be brief, ongoing feedback, like I mentioned, on rounds, day-to-day corrections and suggestions, and giving that more for the group as a whole to help them. So some tips for the formal sessions. Again, you can start the rotation with a goal-setting session. Set specific goals for them, for the team as a whole and each individual. Setting expectations is kind of the beginning of giving good feedback so that they know what is expected of them. And having these abstract goals that they may have, I want to be a good presenter, or I want to write good notes, or I want to be able to call a consultant. And having them determine, well, what does that mean? What concrete thing can we work on? Because there's lots of things that can go through your head as far as a good presentation. So is that you want to make sure it goes in the SOAP format, or that you want to make sure you include pertinent findings, or how do you present the lab? So specific things or concrete behaviors that you want to be looking out for. You definitely want to schedule kind of a midpoint time, and this is important, especially in our busy clinical environment. Just kind of set a time. I know that for me, I've tried to, while I'm on service for 2 weeks, that first part of the last week, trying to sit down with a couple of learners at each day, or having that in my mind that I'm going to sit down with the resident and intern this day, and the M4s this day, and the M3s this day, so that you're not bogged down with 2 hours or an hour of trying to give everybody feedback. You can do it within a reasonable amount of time, and if something comes up and you can't necessarily meet with the resident and intern on that day, you can catch up the next day. So having a schedule set in your mind about when you can give those sessions. Thinking about where and when. It's also important, like I mentioned earlier, to get them to give feedback on their performance, because you can get some good insight into what they feel like they are doing well and not doing so well. Non-threatening collegial environment, and always solicit feedback on your own performance. Again, that's kind of how we all improve, and that's letting the learner know, hey, we're in this together. I'm here to learn just like you're here to learn. I know I'm not perfect, and there's things that I can improve on, even if you've been doing this for however many years. And like Calvin mentioned, having somebody else join in on rounds and kind of being an outside viewpoint of things to give you feedback on that too. So some tips for brief, immediate feedback. You want to provide the feedback again, frequently, ongoing, and immediately. And there's that phrase again, be specific, and include concrete steps. Remember that positive and negative feedback are important. Sometimes it's not, you want to give negative comments one at a time. You don't want to bombard them with like 5 different negative things, because that will put anybody down for sure. And plus, they're not going to hear all of them. They're just going to hear, oh, wah wah, it's terrible. So giving them 1 or 2 specific things that they need to work on. And again, being collegial and non-judgmental. Remember, it's an important element of our job as a teacher. It's a gift, not a put down. So I think somebody earlier mentioned the feedback sandwich, and y'all have probably all seen this before. The positive, the corrective, and then the positive feedback. So there were some thoughts that, this is great, but the corrective kind of gets lost sometimes in the positives. So the learner just hears the positive stuff and the positive stuff and doesn't hear anything in the middle. So there's the modified feedback sandwich, which is the positive feedback and then the corrective feedback and then the next step. So you give them something positive, you give them something to work on, and then you say, okay, this is what we can do next in order for you to get better, or what do you think you can do to improve on that, whatever the case may be. So remember, positive, corrective, and then the next step. So I had a video, but I don't think it's going to play, but it kind of mentions, it is a soccer coach that kind of talks to a soccer player and uses the modified feedback sandwich. So going back to our case, you had the student and the resident. The student presents, the resident interrupts and tells them to give the pertinent findings, and then they talk about the bank with the MSSA, and then the resident says, good job, at the end. So what did this resident do well in this scenario? Can anybody think of anything or point out anything? Do what now? Immediate feedback. Good. So they gave immediate feedback, and he specifically said, or she, you can just give us the pertinent findings, including her vitals. So that was specific, immediate feedback, and that would be applicable to not just this student, but to others on the team. When they're presenting, they know, okay, this is all he wants. That's what I can do when I present as well. So immediate feedback. What else?
Education.
Yeah, education. Told him information about that as well. So that was the good things. What did they not do as well, or what could he improve on as giving feedback?
I think it's the thing, good job before something about what was done well.
Yeah. So good job on what? Like good job on talking, or what was I saying? So being specific about that, and we'll kind of give an example in a little bit, but be specific. What else? What else could he have improved on? Yeah, just interrupts and goes into that. So being a little more gentle about that when you're trying to give the feedback as well. So some characteristics, again, being specific, not generalized. He told him, you can just give us the pertinent findings, including the vitals. So that was specific about how he wanted it presented. And then it was timely, like we already talked about. It was immediate. And then later on, you can kind of go over it in more detail. It was based on objective, not subjective data, not on something he heard, but they were actually on rounds, and he had direct observation of all this. And then, again, the teaching point. So y'all got it. So he didn't really do a good job on the good part. Didn't provide that next step in training, and he interrupted. So y'all get an A+ on this scenario. Remember to use the word feedback, be respectful, provide a specific example. So for this scenario, student presents again, then the resident, instead of just interrupting, says, sorry to interrupt, but could you give us the vitals, and then just move right to the pertinent findings. And then the student talks about the MSSA, and the resident says, VANC gives a teaching point. VANC does have good gram-positive coverage, but we use it when the culture comes back at MRSA. But then ask the what question, right? So what other antibiotic would you like to use? So it gives the student an opportunity, instead of just saying, basically you're wrong, that's not what we're doing, it gives an opportunity to think about it and come up with a plan, a next step. And instead of the good, this will be a great way to give feedback. So your presentation started out good with a clear, concise opening, but I want you to have the feedback, there's that word, that you don't have to provide as much detail in your presentations as you do in your SOAP notes. So on your next patient, try a more focused approach with the objective findings. So that's a specific example about what they want you to do. So all of that is kind of the formative assessment. So moving to the summative assessment. And sometimes the learners view this as kind of their test. So how did I do on the test? How did I do on this rotation? What's my evaluation going to be? How is it going to look? So they think of it more as a test, whereas we as educators have to sometimes put our thinking caps on and go, whoa, wait a minute. Let me remember what this resident did. What am I going to write about them? How can I be specific about things? What's going on? So it kind of leaves us walking around on eggshells with kind of this distraught face about doing these evaluations. And so sometimes we are late in evaluations because we kind of don't know what to say in them. So I think that is one reason we're seeing a lot of late evaluations. But we can get past this and move on to having better summative assessments. So if you've given appropriate feedback and a good formative assessment, and you've told them what they need to work on, and they either do it or they don't, then that's your summative evaluation. That's the summation of the rotation. You comment on the steps that they took towards improvement. When you sit down with the learner at the very end, asking them what things they, how they think things went again. It's also good to kind of talk with them and mention, hey, this is what I'm going to put in the evaluation. I've even had attendings who have sat down with the student or the resident and done their evaluation right there with them, and just told them, this is what I'm marking you for these areas, and these are the comments you're going to have, so that it's not a surprise to them. So evaluation should not be a surprise. They should have already heard all this from you. So it should be, again, no surprise, based on previous feedback, summation, include positives and negatives. And giving specific examples is sometimes important, because you could just say, oh, they're not a good presenter, or they didn't do a good job when they talked to the whoever. But giving a specific example of when they discussed this patient with the nurse, they were very inappropriate, or whatever the case may be. So being specific. And one way, 2 weeks or however long you're with somebody on an inpatient service is a long time to go back and try to remember examples. And so I was at a conference one time where they recommended keeping like a note card on learners, just like you would on your patients. And when you have those specific things come up, writing it down, so that when you sit down 3 weeks later to do your evaluation, you can pull out that card and say, oh yeah, I remember this is what so-and-so did, and this is why, I feel like they're doing great with this or not so good with this. So giving those specific examples kind of helps solidify things. So some tips: fostering their self-assessment is important, balancing the positive and negatives. Don't wait till the end to point out problems. You want to do that up front, right at the beginning, so that they have an opportunity to work on things and improve. And again, going back to their goals. This is what you wanted to work on throughout the rotation. This is what I gave you as far as formative assessment is concerned. I feel like you're doing well with this goal, and you need to work on this part of things. And then kind of getting down to the nitty-gritty of, well, how do I put all of those thoughts into words? And how do I write this out? And I've got a handout at the end if anyone wants it that kind of goes through this. But it lists an opening statement. So it's important to have put in there how long you worked with somebody and what kind of setting it was. So you were with them for 2 weeks on the wards, or you were with them for 2 half days in clinic, or whatever the case may be, to give some context to that interaction with that learner. And then providing their knowledge, skills, and attitudes, and then using the rhyme level, because everybody kind of in education understands this terminology. So are they at the reporter level, the interpreter level, the manager level, or the educator level, and why? Why do you feel like they're on any of those levels? And then give them the feedback on the areas of improvement. So remember, feedback or formative assessment is immediate and it gives information, whereas evaluation is delayed and gives judgment. And these are some great little cartoons I found. Formative improves learning. Summative kind of is a grade. And I like this one about the soup. So your formative is when the chef tastes the soup, but your summative is when the guest tastes the soup. So you still have room to improve if you're the chef, but once the guest tastes it, you're done. So that's the summative. So key points: the 1 minute preceptor, be timely, be specific, provide information for next steps, and remember, all evaluation or summative assessment should follow feedback. Any questions?